Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu.
I'm Dr. Kenny Levine. Welcome back to Health Talk. I'm with Dr. Gregory Albert. You know, people, Greg, know about plastic surgeons for the face and the breast and things like that, but you do a couple of unique things that people don't really associate with plastic surgeons. You want to talk about that a little bit? But before we do that, tell us where people can find you, where your office is, phone number, website, and things like that.
Yes, we're located at Delray Beach,
Right.
6290 Linton Boulevard. The website is www.gregoryalbert.com.
Phone number?
561-495-2700 or 8773-ALBERT.
8773.
ALBERT.
Perfect. Okay, so people think of plastic surgery, they think of faces and eyes and breasts and things like that. Let's talk about some unique things that you do that are not part of the norm.
So one thing that I do is very unique is a mini incision arm lift.
Now, why would somebody need an arm lift?
Arm lift, when I started practice 15 years ago, I had all these patients coming to me and saying, Dr. Albert, I can't wear sleeveless and it's too hot in Florida to wear long sleeves and I don't want to. One of my first patients years ago said, she came in and said that same thing. I don't like showing my arms. I'm a ballroom dancer and I can't stand the wrinkles that just show no matter what. So I did some research and looking around because no one wanted the long incision arm lift, which was an incision that went from the armpit down to the elbow. So I do what's called a mini incision arm lift where I sculpt the entire arm with liposuction and I lift the skin with a hidden incision in the armpit. So that works on most of the patients. The other patients that have lots of skin, too much skin or too much sun damage, then I perfected the full arm lift where there is still an incision but that comes down to the elbow, but it's done differently than it was in the past and it's hidden and you can't see it once it's healed.
Now, is this for patients who only lost a tremendous amount of weight, or is it a natural part of an aging process?
It's a natural part of the aging process.
Okay.
And I'm seeing actually more and more men. Bodybuilders are coming in, they're still lean in their 60s, and they don't like that extra skin. So I do the mini incision arm lift in men as well.
Let's go back to less invasive. You talked about Botox and fillers. You want to talk a little bit, just a moment about that?
Sure.
When that's appropriate and how long it lasts?
Yeah, that's a great question because almost any doctor can do it.
Right.
And there's, as you said, there's a lot of misconceptions about it. So Botox, when it's done right, will give you desirable results that should last about 3 to 4 months. Mm-hmm. Juvederm or Restylane, which are the two main fillers, which I like to use in the folds around the mouth and the lips as well. When it's done correctly, and when I do it, it lasts reliably a year to a year and a half.
Really? That's great.
It is great. It's an instantaneous type of procedure because patients come in, we hand them the mirror, and on the mirror it says wow, but they all say usually wow anyway. They're not reading it. They're just saying wow, this looks great.
So if you did one side, show them the mirror, there'd be it's an instantaneous fix.
That's correct.
That's fantastic.
And the other big advantage we've had over the last couple of years is that it comes with lidocaine.
Okay.
So in the past, I would have to numb up their mouths, similar probably to what you do.
Right.
Now, it numbs as it goes. So patients' satisfaction is even better because they don't have to walk around basically with a numb mouth and a swollen mouth for a couple hours.
Do you do all your procedures in your office?
I do some of the procedures in my office, and then the longer, bigger procedures I do in the hospital. And it's basically the patient's preference. But with the less invasive procedures and as the local anesthetics have gotten better and my skill and other doctors' skills have gotten better, we could do more in the office. And patients request it. So that, for instance, the upper and lower eyes, patients always request it for in the office, and just about 99% can do it in the office. Of course, if they're medically stable.
Well,
facelifts, I do a lot of facelifts in the office under local anesthesia because they request it.
I got to tell you, this has been fascinating for me. You know, our patients can visit us for complimentary exam consults and radiographs at no charge in Tamarack. We've been here, as I said before, 38 years. It's been a pleasure for me, and I look forward to working with you so you can make every one of our patients look healthier and more rested and more alive for the rest of their lives. Thank you so much. It's Dr. Kenny Levine with Health Talk, and we'll see you soon. Good night.